Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to go over the straight leg raise exercise, and in particular, we're going to look at some ways to limit or reduce that potential pain or discomfort that you might feel in the front part of your hip with this exercise. So what's common sometimes with the straight leg raise is this pinching sensation or this achiness or this just general irritation of that front part of your hip joint when you are lifting the leg up and down. And the reason for this is a lot of times we have what's called an anteriorly dominated hip, which means all the muscles in the front part of our hip are tight and overactive, and then the muscles, the big stabilizing muscles of your glutes and the back part of your hip are not working as well as we want them to. That's a very simplified explanation, but kind of why that can occur sometimes. And otherwise, just general muscle fatigue as well. So what are some things we can do? Well, first of all, we want to make sure that you're laying down on your back to perform this exercise. Sometimes I'll see people who are kind of in this lounge position or sitting up tall, and what happens is your hip is already in this flexed position, and you're just limiting the available motion you have to do the movement. Rather than starting in a more neutral position, you can lift the hip a lot higher. The second thing has to do with your hips and your pelvis. So a lot of us have what's called an anterior pelvic tilt, which means our pelvis just naturally is tilted in this forward or anterior position. And what this does is it causes less room in this front part of the hip, so when we go to do anything that's flexion related, we start to notice that pinching or that discomfort maybe a little bit sooner or a little bit more easily. So what you can do when you're laying on your back, before you start to raise your leg up and down, you actually want to think about your low back and push your low back down into the surface that you're laying on. And then maintain that pushing, keep pushing down with your low back as you perform the movement. And what that does is simply it starts to posterior pelvic tilt or tilt your hips just a tiny bit backward, which is going to open up some more space in the front of the hip joint and hopefully lead to less irritation, less discomfort with the movement. Another option is just take a look at your technique and form with the straight leg raise. The straight leg raise is really to focus on that active contraction of the quadricep muscles. It's not about, how high can you get the leg, can you swing it up and down super fast, or anything like that. Really, it's a nice, slow, and controlled movement. You don't have to go super high, and you don't have to go super fast. Just nice and slow, within a limited available range of motion, is perfectly adequate. And really, I see sometimes people will put an ankle weight around their ankle to add some resistance to this. That's okay, but I'm not a huge fan of that because I think by that time where you're able to really put an ankle weight on, you're going to be progressing to some more dynamic, some more weight-bearing, standing type of exercises to strengthen those quadriceps up. Another cue or another suggestion is to loosen up and stretch out the front of your hip. So there's a bunch of different hip flexor stretches, stretches for that front part of your hip. But an easy one you can do is laying again on a bed or a sofa, and you're actually going to scoot all the way to the side, and you're going to let that leg that you want to stretch come off the edge of the table. And it's just going to hang off the side of the table, and you'll notice as you relax and let gravity do its job, you'll start to notice that stretch in the front part of the hip. If you want to increase the intensity a little bit, you can bend the knee. You can't see it in the video, but you can try to bend your knee backward. And you can also hug the opposite leg up like this as well. And usually holding that for maybe 30 seconds or so and doing 2 or 3 repetitions. And then the last option is just try a different exercise that allows the similar benefit. And the similar exercise is going to be quadricep sets. Now, with quadricep sets or quad sets, all you're doing is in this long sit position or laying on your back is you're trying to contract and squeeze those quadricep muscles, trying to push the knee down into the surface, trying to straighten the knee, and trying to hold that for a count of 10 seconds. A simple cue you can use is think about is if you're trying to lift your heel up off of the mat or off of the surface as you try to straighten that knee and hold it and count for maybe a count of 10 seconds. Similar to the straight leg raise, you're working on contracting and squeezing that quadricep muscle. Going to get a lot of those similar benefits without all the motion and without all the possibility of aggravating or hurting or causing discomfort in the front part of your hip. So thank you very much for watching. I hope these allowed some useful suggestions. Be sure to leave your comments and questions below so I can get back to you. As always, please like if you got something useful out of this to help spread the video to other viewers. And please subscribe if you don't already. If you're interested in watching all of our videos, we share exercises, we share frequently asked questions, discussions of a variety of topics related to knee replacement surgery, pain management, walking, range of motion, and everything else in between. Thank you very much for watching.